Good morning. Welcome you all to our course Radiation Oncology Physics, lecture number 17. And last day we have started the fourth week of our course, and you must have observed that now we are heading towards more specific and physics and technology relating to the radiation oncology, and today class we are going to discuss the practical calculations and isodose charts. As last day we have discussed various central axis depth dose parameters and how they define, and today we will discuss the what is the practical applications in for treatment of cancer patients in radiation oncology department. And today we will learning objective of our class is practical calculations, the isodose charts, and we will discuss also some devices such as beam directional and collimation devices and beam shaping and shielding or cell shielding devices. These devices are applied as per our needs of treatment. Now, the practical or clinical situations we have in our department, we have two type of technique which we are used for treatment of cancer patients. They are SSD and SAD technique. Now, if we elaborate more that SSD and SAD technique, SSD is source to surface distance and SAD is source to axis distance. Here SAD is source to axis distance. Now, you can see two situation here. Now, this is suppose this is the patient, and where source is we are treating this target, the red one is target, and this patient separation is approximately 20 centimeter, means from this the one side from another side it will be 20 centimeter. We call this separation as interportal distance or just simply patient separations. Now, here it is 20 centimeter. It is just we consider that now if we consider this patient having the interportal distance of 20 centimeter. Now, target is placed at the center and the target to the skin surface distance is 10 centimeter. This is the target to skin surface distance, depth is 10 centimeter. Now, in SSD technique, we need to keep this distance, source to surface distance, this distance 80 centimeter, and from this direction, this is the source, and here also this is also source. So, from this we are treating this target by two field. From one this is, you can call it as anterior posterior, or you can call it as posterior anterior, AP field or and TA field. So, they are actually parallel opposed field setting. Now, here we have to keep this distance 80 centimeter fixed for both the field. So, this is the SSD technique, and during SSD technique we use the CADD parameter, percentage depth dose. Now, for source to axis distance SAD technique, where this distance 80 centimeter, it is 80 centimeter, this is 80 centimeter. So, axis, source to axis distance. Now, what is axis? SAD, what is axis? This is the source to axis distance, or you can call it a source to isocenter distance. What is isocenter? Isocenter is a virtual point of any machine where the axis of rotation of gantry, axis of rotation of collimator and axis of rotation of couch intersects each other. So, this point is fixed for every treatment external beam treatment machine. Now, if we treat the same patient with SAD technique, you can say we have the interportal distance of 20 centimeter, the target depth is or you can call it as this is this point, you can call it as this point, this the center point, you can call it as prescription point where the dose is prescribed. Now, here also we treat the patient with from two direction, one is anterior and one is posterior. So, this is AP field and this is PA field. Now, here we keep the distance say 80 centimeter fixed from source to this target center. So, we localize our target to the isocenter of the machine, but here we just keep this distance fix SSD 80 centimeter source to skin. So, here in SSD technique skin is fixed with 80 centimeter, but in SAD technique the axis of rotation is localized within the target and it is 80 centimeter. So, in SSD technique in last day during discussion of PDD and TAR we have discussed that PDD is a function of energy of the radiation, the field size of the portal and the depth of the target prescription point and the SSD. But here there is no dependence on SSD because we have keep this target, the distance is 80 centimeter. So, the SSD technique is used for single field treatment or for some head and neck cancer patient treatment where only, or some APPA where the tumor depth is not much higher, but for thorax region and for pelvic or abdominal region where we use the deep seated tumor for treatment and where multiple beam directions are used for the treatment planning, where we use the SAD technique. Now, these are the practical or clinical situation. Now, how to calculate the treatment time or for these both of this technique. Now, for a quick review, this is the percentage depth dose and the tissue area ratio. Here this distance SSD is fixed, it is 80 centimeter or 100 centimeter. In linear accelerator it is 100 centimeter and most of the cobalt we have 80 centimeter of SAD. Similarly, the SAD is here 80 centimeter or 100 centimeter. Now, in formulation of percentage depth dose, central axis depth dose parameter PDD, the PDD is defined as the ratio of DD at dose at a given depth D centimeter D depth DD with the dose depth of dose maximum, where dose reference is equal to the dose maximum. So, this is the and it is expressed in percentage and it is expressed in percentage. Similarly, in definition of TAR, TAR is the ratio of dose at a depth D with the dose at same point, because we keep the distance same. Here you can see the dose measurement point distance from the source, dose measurement point here in the phantom and in the AR are same and we keep it as SAD. So, we have eliminated the distance dependence from this parameter TAR. Now, in definition of PDD, you can see that these are two terms, one is PDD and one is depth of dose maximum. We have to generate all these both table PDD and DR. This is actually the known as the output of the machine or for SSD setup, and this PDD we have to generate from our measurement. We have to create the table. We will show you how this table look like. And similarly, we need to, for SAD calculation, we need to develop or measure the various TAR values for different field size, and we have to measure this DFS. Here this is the output of SAD technique and this is the output of SSD technique. So, these are two output we have to measure and we have to form a table. Similarly, we have to form a table of PDD and we have to form a table of TAR. This PDD and output of SSD is required for the treatment calculation of SSD technique, and TAR table and the output of the in AR were considered as the, we have to form this table and for the calculation of the SAD technique. Now, how to generate the output, how to generate this table? Here we have to make this type of situation. We have to keep this SSD 80 centimeter, and we have to measure the dose at D max. We have to measure the dose at the depth of D max in the phantom, and you can see these are the actually the field size, different field size. You have to starting from 5 by 5 to maximum field size, that is for cobalt 35 by 35, and for linear accelerated is 40 by 40. So we have to calculate all these square field for the output should be measured, and we keep the detector this point. So this is the process how we calculate the output of SSD technique. Now in SSD technique, we have to calculate, we have to measure these same type of situation. We have to measure the dose at SAD 80 centimeter, distance, and this measurement is done for almost all the field size. These are actually the different field size we measure the output. These are the field size. So we have to measure this output, and we have to keep in a table. Now this is the percentage depth dose table, and you can we have the similar type of tissue air ratio or TAR table. Now you can see this is the percentage depth dose table for cobalt 60, for cobalt 60. So we know that PDD is function of E energy, the function of field size, the depth, and the SSD of the machine. So here cobalt 60 is the E here, and 80 centimeter source to surface distance is mentioned here. So it is SSD, and you can see this is the field. These are the actually this direction we put this our field size. They are square field size. So 0 by 0 means there is only a narrow beam, and we have 4 by 4, 5 by 5, 6 by 6, and up to 30 by 30 centimeter. And we have depth is mentioned in this direction. So here 0 depth 0.5 centimeter, 1 centimeter, 2 centimeter, 3 centimeter, and all these parameters were mentioned here. We have also mentioned the BSF or BSF value, backscatter factor, for in this table for cobalt 60 80 centimeter SSD. Now you can see, if we consider that what is the PDD of 15 by 15 centimeter field size at 5 centimeter. So here is the 15 by 15 centimeter square field size, and this is the 5 centimeter. So 5 centimeter depth. So this we have, it is 80.7%. And if we consider what is the PDD of 10 by 10 centimeter at 15 centimeter depth. So here we have 10 by 10 centimeter field size, square field size, and 15 centimeter depth is 40%. So it is 40%. So like this we can retrieve the, we can find out our PDD value from this table. And similarly we have also the TAR value, but where only there is no mention of SAD. There SAD will be mentioned at 80 centimeter. In TAR value SAD will be mentioned at 80 centimeter. Now you can see that these all data are given in the form of square field, and but in our clinical situation it may not be possible to treat all the volume, all the target by square field only. So we need to have, we design our field according to our requirement. It may be the rectangular, sometimes we sealed the some portion of the field, and where we use very complex and very irregular fields. So there is a formula to find out the equivalent square field. Every field of perpendicular field, every rectangular field are required to calculate the equivalent square field. And we need to calculate the side of one side of the equivalent square field. Now if a rectangular field where length is A and width is B, so we have the formula, the side of this equivalent square field is 4 multiplied by area divided by perimeter. So, what is the area? So, area is this is actually 4 multiplied by area, means A multiplied by B divided by 2A plus B, or you can call it as 2A multiplied by B divided by A plus B. This is the side of one equivalent square field, of the rectangular field of A with A length and B width. Now, how to calculate the treatment time calculations, because we need to give the radiation as according to our machine is calibrated with the treatment time, means how much dose the machine is delivered in how much time per unit time. So, output we get whether it is for TAR or whether it is for SSD or SID technique, we have two kind of output, but it is mentioned it centigrade per minute. So, this is the output. Now, PDD is expressed, I have shown you that PDD expressed in percentage, and TAR it is the ratio. So, PDD we know that we know this PDD value from the table, and we know the output of the machine for that particular field size. Now, we just need to find out this DD, this is the dose rate at in centigrade per minute at the prescription dose, prescription depth, and treatment time is prescription dose. If we give the 200 centigrade dose by AP and anterior posterior and posterior anterior two field, so we deliver 100 centigrade from this direction and 100 centigrade from these directions. So, these are the clinical situation for this simple treatment technique. This is parallel opposed field technique, and we have to find the dose rate centigrade per minute at prescription depth, and treatment time will be calculated the prescription dose divided by dose rate at prescription depth. So, these are known parameter from the table which we have prepared from our measurement, we generate from our measurement, and similarly in SSD technique we know the TAR value from the table and we know the output of the SSD technique. So, we can find out this DD, this is the dose rate at prescription depth, and that finally we need to calculate the treatment time, that is prescription dose per at dose rate at prescription depth. So, this is the SSD setup and this is SID setup. Now, from this calculation, they are basically very basic calculation in radiation oncology. As you can see that we have defined only the central axis dose distribution of the central axis along the central axis, but this central axis depth dose distribution is not sufficient for accurate planning or to see the dose distribution in 3-dimensional, because we treat the 3-dimensional volume or 3-dimensional target volume. So, we need to have a dose planning system which should incorporate all these parameters for all direction from 3-dimensional directions. Now, isodose, so we have the isodose curves. These isodose curves, they are actually the curves which passing the equal dose. Similarly, we have the isobar curves in our world map, where the same points with same pressure points are connected with some line, and they are known as isobar curves, by which we can see the we can predict the climate changing and all these things. Similarly, in radiation depth in dose distribution for our patients, we have to define the isodose curves. Which are isodose curves? They are curves passing through equal dose. Now, we have isodose charts. They are the family of isodose curves. Here we can see there are two types of charts are there. They are family of isodose curves and they drawn at equal interval of the dose. Here you can see there are two types of curve. One is 90, 80, 70, 60, 50, 40, 30 and 20. These are their equal interval of dose. These curves were drawn. It is not that we cannot draw the 91 or 93 curve, but for the convenient we do the at 10 increment, or you can maintain the increment for this isodose drawing. Now it represents the variations of dose with the depth and the transverse directions. This is the depth and this is the transverse directions. We can see the dose is this isodose chart is this show the dose variations with the depth and the transverse directions. Now you can see here this is the this is two type of curve is shown here. One is normalized and another is not normalized. So this is not normalized. So in this type of curve generation, first this is actually the dose 180, 160, 180, 160, 140, 120, 100, 80, 60 and 40. Now you in normalized curve we normalize this point, any dose we just normalize this 100. So it is the higher dose will be closer to the surface and higher dose would no, this is actually both are normalized. Here this is this curve is normalized at this point, at any point, and this curve is normalized at dose maximum. So maximum is the 100 and following the rest are the 90, 80, 70 and all these are in the lesser percentage. But here at any point if we normalize the dose at any reference depth, it will there will be higher dose and there will be lower dose. It will similar to the normalization of any, if we normalize the any number of a class and if we normalize the maximum marks holder and consider this is as 100, then for the rest will be the less than 100. But if we consider a average student number with 100, then there will be more than 100 and there will be less than 100. So this is the concept of normalizations. So here this curve is normalized at maximum dose and this curve is normalized at reference point dose. Now isodose charts, they have some general properties. You can see, you can observe from this isodose chart that dose at any depth, if you consider this depth, this is higher at the central axis, and if we plot a cross touching point or tangent from this point, you will see these points are lesser dose, means this is 70 degree isodose line. So this point will get the less dose from the central axis, but central point is 70 degree. So maximum dose will be central axis at any depth and gradually decrease towards the edge of the radiation beam. These are the edge of the radiation beam. So near the edge the dose decrease rapidly. Near the edge you can see these are the point where dose is decreased very rapidly. And outside the geometrical limits, if we consider these are actually 10 by 10 centimeter field size. So this is 10 centimeter and another section it is not shown in the figure, it will be also 10, but outside the geometric limit there will also dose, and these dose variations because of scattering and because of leakage of the collimation system. These are actually the property of isodose chart. You need to understand these things, that dose at any point, any depth is maximum at central axis and they are gradually decreased towards the edge of the beam, and near the edge they are called penumbra region where dose is decreased rapidly. This penumbra is dependent on the source to surface distance, the source size and the source to diaphragm distance. Now outside the geometric limit, those variations we see because of the scattering and leakage of the scattering from this irradiated volume and leakage of the collimation system. Now this is the dose profile at a specified depth. Now if we consider, if we see this cross sectional view of the, if we consider as cross sectional view of any of this isodose chart, we will see this is the dose profile. So dose profile, it is maximum at the center. Now it is 5 and it is this is, if we consider this is a 5 centimeter, this is 5 centimeter, this is 5 centimeter, means this is a 10 by 10 centimeter field size dose profile, and you can see that it is 90% at 5 centimeter and it is beyond this geometrical limit. There is also a dose considerable dose is there. So this part is known as the penumbra. Penumbra is you have to define, and it is defined as per user choice. It may be 90% to the 20% lateral distance is known as the penumbra region, penumbra distance, and this is the dose profile. Now this is the cross sectional view of any field. Here center is 100% and you can see this is 99% dose profile, and this is 95% and this is 90%. So radiological field definition is the area covered by 50% isodose line. Here this is the, you can see this is dotted line, this is the 50% isodose line. So these line actually match the geometrical field size. So this, if you could see, if it is 10 by 10 centimeter, so this distance is 10 centimeter and this distance will be the 10 centimeter. So this is exactly matches the geometrical field and field size, and 50% is considered as the field size of the radiological field size, which matches with the geometrical field size. And these are actually the beam directional devices which use for radiotherapy. We have collimators. They may be the primary collimator which actually defines the maximum field size of the machine, and we have the secondary collimator that defines the field size, and we have tertiary collimators. They are further define, or we can see any irregular shape of field size. So these are actually the beam shaping and shielding devices, where these devices are used to protect critical organs from primary radiations, and these are maybe this shielding may be the custom block, or we can custom block shielding may be used, or we can individualized shielding may also be used for the protection of the critical organ from the primary radiation. Sometime we use the multi-leaf collimators. We will discuss later on that what is multi-leaf collimators for this shielding purpose. Thank you.